Καλημέρα. I'm Έφη Κουτσουβέλη. Θα μιλήσω στα αγγλικά λόγω των συμμετεχόντων σε αυτό το τραπέζι που είναι από Ιταλία και Φιλανδία. So I would like to welcome everybody to this round table, which will be focusing on the European Code Against Cancer, its 5th edition. I'm very pleased to introduce our speakers who bring diverse expertise from clinical practice, public health and policy. I'm the president of the European Federation of Medical Physicists. For those who do not know, medical physicists are part of a multidisciplinary team within the hospital settings, and we also work in industry and national regulations. I would like to welcome Juha Pekka Turunen from Finland. He's a medical doctor specialized in clinical pathology with special competency in health administration. He's the newly elected president of the Association of European Cancer League, and he was president of the Nordic Cancer Union, and he's also a member of the steering committee of the first national cancer strategy in Finland. Professor Mελέτιος Αθανάσιος Δημόπουλος is already on the stage. He is the chairman of the Department of Clinical Therapeutics at the University of Athens School of Medicine. He also served with great distinction as rector of the University of Athens for many years, and he currently serves on the scientific advisory boards of numerous European and international networks and scientific societies. Professor Δημήτρης Μπούμπας from Greece, also a medical doctor, chairs the executive committee of National Central Health Council. His expertise is in molecular immunology and internal medicine, and he chairs the 4th Department of Medicine at the Attica University Hospital, and he's also president of the Athens Medical Society. And the last one is Eduardo Pisani. Is the Chief Executive Officer of Volcan International, a global non-profit organization in the field of cancer policy. He knows well the functioning of the European Union and of international organizations in the area of health and pharmaceutical policy and legislation, and he has strategic advisory and board roles with international and European organizations. To begin this roundtable, I would like to invite Professor Turunen to give a brief introduction to the European Code Against Cancer, the 5th edition, and to outline the rollout of its international versions in national languages planned, I think, for tomorrow.
Kalimera. Very nice to be here in Athens. I'm from cold Helsinki, which is minus 20 degrees and snow. So it's pleasant to be here. I have some slides. Probably we start them. So today's topic is about the European Code Against Cancer. Thank you. And as we all know, it's a huge task for us to alleviate the cancer burden in the whole Europe, since we have a lot of work to do in the future. Cancer is going to be the leading cause of death in Europe in 10 years. Something about European Cancer Leagues. We are so happy that ΕΛΛΟΚ has been applied and accepted as a newest member of European Cancer Leagues, which is an association of 35 cancer leagues in 28 European countries, which have a head office in Brussels. One important thing is that we are non-profit cancer organizations. We don't accept support from tobacco industry or any other companies which produce harmful products or services to our health. Here in the map you can see the white countries are the ECL members. The new European Code Against Cancer has been already released, but tomorrow it's the World Cancer Day, and there's a lot of focus on this tomorrow since it will be released the translations to European languages the first time, so it should be available for reading in your own language tomorrow. The initiative for this code has been from European Commission, and it's operated by International Agency for Research on Cancer, IARC, which is very important since they are doing the most valuable work for cancer risk factors. They are making studies, monographs, etc. So we have the most exact data and scientific evidence that in use. The first version was in 1987, and there's this map on the right corner containing 14 squares with symbols. These are the main risk factor groups that have been found. I just take a few examples from them. Smoking and alcohol. We've been debating a lot about these. The one peculiar thing for most of these risk factors is also that they are risk factors also for many other diseases, for non-communicable diseases. And that makes it even more important. We can prevent diseases also other than cancer with these same operations. This newest edition has the new feature for the first time, so there is recommendations for policymakers. So we should study that in detail together. Then just a few examples, what does it mean for the ECL and European cancer societies, just like ΕΛΛΟΚ, and we will discuss about your thoughts in the future. But ECL is an official supporter for this code, and it has been used a lot. Actually, it's a kind of basis for prevention. Some examples from Italy. There are a lot of campaigns making awareness of the code with employers and employees, with specific projects. In my country, in Finland, there's an online platform where we give information, and we have also plenty of projects, especially for young people, trying to prevent smoking and nicotine use. And ECL has also young ambassadors in different countries which also use this cancer prevention among peers. So in brief, this gives a perfect tool for us to think about our operations together in Europe and also in national level and in our societies. Thank you.
Thank you very much for this description. I would like to ask now our Greek panelists. We've heard the ministers some minutes ago. How do you think this European Code recommendations be effectively implemented in Greece, particularly in combination with our national cancer screening programs. We have been all experienced, I believe, some actions of this program. And could you maybe identify challenges and opportunities in its dissemination and adoption in Greece? I would like to ask first Professor Dimopoulos, who may highlight also some recommendations inside this European code.
First of all, I would like to thank ΕΛΛΟΚ for the kind invitation. And I believe, as it was mentioned, this is a very comprehensive and a very detailed guideline for the general population. And it is important to stress the fact that by implementing some of these measures, we will not only reduce the incidence of cancer, but also will affect other diseases, because that there is a significant interplay between inflammation, autoimmunity, and cancer. And as it was said, except from the smoking, the overweight and obesity is an issue that has been highlighted in recent years. For example, endometrial cancer is becoming the leading cancer of in women of the gynecologic cancer, and it is clearly related to obesity. And already there are data to indicate that by using GLP-1 agonists and reducing obesity, you may affect the incidence of endometrial cancer. So you see there is a significant interplay. So physical activity, diet, alcohol, well known. Breastfeeding, for the first time, I think there is a recommendation to have breastfeeding for as long as possible. Sun exposure, cancer-causing factors, air pollution, cancer-causing infections, and we will have experts that will talk to us about the HPV, hormone replacement therapy, and there is a very recent paper in the Journal of American Medical Association indicating that there may be a role of prevention of ovarian cancer by removing the tubes, because we know that ovarian cancer starts in the tubes and leaving the ovary, especially in individuals that have a high risk due to genetic factors. So I believe that there is a very comprehensive guidance that should be implemented, and already in Greece, as it was said, for the last few years, we have massive screening programs that have already had an impact. They have reduced, they have detected asymptomatic patients with colon cancer, with breast cancer. I believe there should be more awareness about the role of low-dose CT in smokers, and to continue to implement and to reinforce screening with pap tests, with molecular testing for HPV. So I believe that, and as we know, in the United States, recently the American Cancer Society indicating that there has been a dramatic decrease in the mortality from cancer. In Europe, we have similar data, 2% decrease as compared to 2 years ago. And I believe that we are on the right path with collaboration of patients' organizations, comprehensive cancer physicians, researchers, basic scientists, pharmaceutical industry, and with the help of AI, we should have an enhancement of early detection and prevention. Thank you.
Good morning. Thank you for the opportunity to be here. I would like to add the chair of the Central Health Board of Greece for our foreign visitors. This is an advisory board to the Minister of Health, which advises the Minister for issues related to good clinical practice and also education, graduate education and continuous medical education. The Central Health Board has become aware for the need to create a prevention culture within the medical professionals. We didn't have such a culture. If you look at the curricula of the medical schools, prevention is moved to the side. So the Central Health Board has had regular meetings with the deans of the medical schools in the country and tried to elicit their help to incorporate prevention into the medical curriculum. At the same time, the Central Health Board collaborates closely with the Scientific Society, and at this point I would like to thank the Oncologic Society of Greece for the very fertile collaboration that we had. With the scientific societies, not only with oncologists, but also with other specialties, we push and we ask them to update their curricula regularly. Of course, the medical curricula in Greece, there is an inflexible mechanism that regulates. We're trying to change it now at the Central Health Board. In any case, we try to strengthen the prevention and the cancer care within the curricula across specialties, which includes internal medicine, pediatrics, and so on. A final thing is, in the medical exams, we have made an effort to increase the number of questions that relate to the cancer prevention, but not only cancer prevention, but also infection prevention in the medical exams of internal medicine, of oncologists, cardiologists, as a way to increase the sensitivity of the medical professionals. So in sum, the Central Health Board is listening to the medical society, is evaluating the data, and with meetings like this, tries to provide the best advice to the Minister of Health, who relies on our advice in setting the priorities. Thank you very much for the opportunity.
Thank you very much. And I would like to highlight, because we had for many years a collaboration with Professor Búbas from our position as medical physicists, medical physics societies, that what he said about the updating and revision of the core curricula of all professionals to include this cancer prevention is very important, and currently the European Federation of Medical Physicists, together with the European Radiology Society, Radiotherapy, ESTRO, and Nuclear Medicine Society, we are updating our curricula for the medical physics expert, and this is a very important indication and consultation to include also all the cancer prevention topic. So to continue, and I'm not sure about the time because we were delayed a little bit, I would like to ask our Italian panelists, sorry, I'm saying your origin, Eduardo, based on your international experience in healthcare across countries with diverse cultures, customs, and behaviors, because we know this exists in Europe, what guidance or practical steps would you recommend to increase public awareness of the European Code recommendations in Greece? We have the Mediterranean culture.
Yes, yeah. Kalimera, and thank you again very much for the opportunity. There are two things that come out of this new European Code Against Cancer that I would like immediately to bring to everybody's attention. First thing, it says on page 1 that 40% of cancer cases are preventable. Second thing, it says that we have to move from awareness to social action and behavioral action, which translated for me into practical terms means that it's no longer like the 10 commandments, don't kill, don't lie, etc., but there is also an integrated approach with the social ecosystem around the individual behavior. So that is why the implementation phase, to your point, is becoming so important. IARC, which originated the Code Against Cancer, has made a survey across Europe to check, just before the launch of the new code, what was the level of awareness amongst the population of Europe of the Code Against Cancer, and it's very, very low. Very low. It's disappointing that various generations, from the younger to the older, are not really understanding what are the positive implications and the value of respecting or meeting and implementing exactly these various items on the code. One thing which happened, therefore, is that the Code Against Cancer has been also integrated into the EU public policy action and into specifically EU cancer policy action. This has generated a number of projects, and I would like to mention one for those that answers specifically your question. Selfishly, I have to say that Olcan is part of this project, which is known as 4P-CAN. So you can find it on the internet, and it is almost a social journey to prevention, to the implementation of cancer prevention measures. 4P-CAN is a very short acronym for a very long title, so I'm sorry, it would take more than the entire panel to read the name of the project. Personalized cancer primary prevention research through citizen participation and digitally enabled social innovation. This is the scope of the program, which aims to identify barriers primarily of a regulatory nature and of a socio-economic level. Now, the implementation stage has been translated into social behavior science experiments. And experiments have been carried out in selected countries, primarily in Eastern Europe, through living labs. I don't know if this expression rings a bell. Living labs are communities, workshops that identify the root causes of certain behaviors. Why do we not eat appropriately? Why do we not exercise? Or why do we drink so much and why do we smoke so much in this community? And the analysis, the social behavioral analysis, is fascinating because it demonstrates that it is really a network, an ecosystem, which is deriving from families and groups of families and friends that determines certain behaviors. Now, the 5 countries which have undergone these quote-unquote experiments and tests, as I was saying, are primarily in Eastern Europe, Romania, Bulgaria. Also non-EU countries have been included, like Moldova, Montenegro. But the experiments are, and the pilots are perfectly transferable to Greece and to any other country for that matter, and that's exactly the purpose of the whole program, is to demonstrate that by bringing together communities and by bringing together networks of communities, social and behavioral change can happen. Now, in closing, there is also a policy dimension associated to that, because the implementation and the integration of these code against cancer and all the various items in it has to be integrated into guidelines, primarily health policy guidelines, but also clinical in some cases. There is a part that focuses on the clinical dimension here, HPV vaccination, etc. And these has to be translated into policies. There is a working group, a work package in jargon that will translate ICAC recommendations into national legislation, and that's the responsibility of all CAN. So we will mediate, so to speak, between IARC and national frameworks, legislative frameworks, in order to implement precisely this code. Thank you.
Thank you. I would take the opportunity for this last phrase that we have to involve regulators, national legislation and all this, to ask my last question to all of you. For the first time, the European Code is aimed not only to individuals, but also at policymakers. This is very important. From your perspective, which stakeholders must be actively engaged to ensure a successful uptake of the recommendations? For example, which are the responsibilities of the ministries, healthcare professionals, patient groups, media, pharmaceutical companies, together, of course, or under a European coordination? Based also on your experience in the Nordic countries. I will start from you, Juha.
Thank you. This is a very big question. So for the policymakers, I think this idea of health in all policies is extremely important, since the health is maintained and regulated also other than social and welfare and health sectors. For example, how do we build our cities and how we make the exercising more easy. For example, do we have sunscreen buildings that we don't get ultraviolet radiation, etc., etc. So there are plenty of things. For the Nordic point of view, I think we understand that these cancer strategies are very important. They give us the direction also for the legislation and for implementation of those goals that we are settling. And it's very important to ask at the national level the stakeholders to the conversation. I think the cultures are different in Europe, so there are no standards, rules. But I think we have to work very hardly for that, and I think the cancer societies have a lot in this discussion, since they and we are expressing what is important for the patients, and that is the basis for this work.
Yeah, I fully agree, and I believe that in each country there are agency ministries that have the task to reinforce the prevention of cancer. For example, the Ministry of Agriculture, they have to check the food products, usually agricultural products coming from countries like India, Asia, Africa, that there are no regulations about the use of pesticides, so we don't know exactly what's coming. The climate crisis, as we know, causes hazards that are not expected. and there are hidden dangers that they're not so apparent, such as, tobacco, alcohol, obesity. So the stakeholders may be even larger, and in each ministry, maybe there should be a sort of a cancer prevention committee that would focus on the particular aspects of the ministry. For example, the water. I mean, we heard, for example, that in the island of Egina, the people should not drink the water. I mean, who will check all these hazards that are silent and not easily, obvious to all of us? Thank you.
I will only concentrate on the increased awareness that you brought up as it relates to a southern European country like Greece. In Greece, there are close to 30,000 pharmacies dispersed throughout the country. I see a lot of leaflets about different things, but I don't see anything about prevention medicine. So this is something that we need, and also we increase their awareness of the pharmacists and the dentists and other health professionals. The second is there are other opportunities to intervene at the school level and with the teachers, but also at the churches. Southern European countries, they have more church goers. So I will try to elicit their help to spread the word and to increase the awareness. I'm a little bit afraid about the media, because the media, they're bombarding the citizens with a lot of health information, and at the same you have a fatigue, and they close their ears. So I will just be a little bit more selective and go in areas that people have not used before. So in summary, schools, churches, or other areas in the society that they get together and get not only the physicians, but also pharmacists, dentists, and other care professionals aboard. And of course, something that has not been said is, since the patients are closer to the society, get some input from the patients, and I'm sure this will come from this meeting, how to increase the awareness about the prevention. A final word is, if I find the cancer, am I able to lead this journey of the patient from prevention to treatment to a successful end? I'm not sure that we have all the pathways in place to assure that we'll have a happy end. The ministry talked about the encouraging results, but there are still improvements that we have to make.
I think we all agree that it is a stratified strategy which is required, depending on the target group, and depending also on the kind of personalized, tailored messages that have to be addressed to various stakeholder groups. For instance, if we speak about policymakers, I think that the return on investment of prevention measures is also clear. And by the way, as part of the analysis of this 4PCAN project, there is also a chapter dedicated to the economic indirect costs of morbidity and mortality. So there are certain arguments which have got to do with health economics that can be submitted to policymakers. On the other side of the spectrum, and I build on your comments, there is a community-based approach that obviously is very different from what policymakers have to understand and have to learn. It seems from this social behavioral science that young people consider all this list of things that cannot be done, don't drink, don't smoke, etc., almost as a condemnation to prison. And I'm not exaggerating, I'm paraphrasing perhaps the results, but the figures are very clear. Therefore, put it this way, the response has to be very much tailored to that generation and has to be very much driven towards a positive attitude as opposed to you will die if you smoke, or you will get cancer if you drink too much, etc., etc., etc. The messages have to be completely different and have to be constructive. In closing, and again, from a strategic perspective, a national cancer control plan must have as chapter number 1 prevention measures, prevention intervention. So it's all in there where not only these measures are integrated, but an action plan to implement them can be developed further. Thank you.
Thank you very much, all of you. I think we are okay with time. I think we showed in this round table this multidisciplinary approach we should all have together, of course, with the ministries, the regulators. While I was coming here to this round table, I showed to my son, 22 years old, these European Code guidelines, because, we have to convince the young generation, because the key message is important from all of you. We have to work to the young generation. I was showing, let's say, some actions, increase the taxes in smoke or alcohol, and he told me, okay in smoke, but no in alcohol, keep it low. So, we should invest, because also from my role as president of the European Federation of Medical Physics, I like to invest to the young people. So by training them, by educating them with all these means you previously mentioned, it could be a key starting point to succeed, let's say, our ultimate goal. Thank you very much. Thank you.